welcome to our next episode of the Hormone Café. Today, we are going to talk about PMS, which stands for premenstrual syndrome, and PMDD, which stands for premenstrual dysphoric disorder, which is a topic near and dear to my heart because I want everybody to feel amazing every day. And when we think about PMS, oftentimes we normalize that. And I want you to realize it's not normal and we shouldn't be PMSing in our luteal phase. So the things that I wanted to cover today are what is PMS and what's PMDD, what are some of the root causes, and then what is our holistic treatment framework, what are some of the treatment options, and then go over a couple patients that I've recently treated. What is PMS? Sometimes when we think, oh, I'm just PMSing, technically what PMS is in our luteal phase, in between the time that we ovulate and the time that we have our period, we can feel, especially mood changes are the biggest symptoms. Sometimes people describe it as feeling really irritable, having a lot of rage, or just generally not feeling themselves. And then other PMS type symptoms, sometimes people will get cramps, headaches, or breast tenderness. And then PMDD stands for premenstrual dysphoric disorder, which means that you have such debilitating mood symptoms that it's actually affecting your day-to-day functioning. So if you have any types of PMS symptoms at all, there's almost always an underlying pathological root cause. It's not normal to say, oh, I'm just PMSing. So if you're feeling irritable, rage, you had a really kind of moody day, and then the next day you got your period and you look back and you thought, oh, that's why I was feeling so bad that day. We really want to look into that because that can be a sign of things like blood sugar issues, inflammation issues, hormonal imbalance, and gut issues. When we look at our root causes that we want to look into, one issue that can really cause a lot of PMS symptoms is blood sugar. So when we think about in our luteal phase, I often have people do continuous glucose monitoring because you will be more insulin resistant in your luteal phase. That's why we crave more carbohydrates. And when we think about that, after we ovulate, our ovaries need to make a lot more hormones. So they need to make twice as much estrogen and progesterone. So we do need more calories and more rest during our luteal phase in order to enhance those processes. But that's why sometimes our body craves carbohydrates because it wants those energy sources. So one thing that we want to make sure that we do is just balance our protein to carbohydrate ratios. We want to keep our blood sugar stable by just making sure we're eating a 1-to-1 ratio of protein to carbohydrates and that we don't just eat sugar because sometimes in our luteal phase, we'll crave a lot of sugar. And if you really have to know yourself, sometimes if you're gonna have a piece of sugar, it'll really enhance your cravings and it'll make you want to eat a lot of sugar, in which case you want to try to avoid eating sugar. Or if you're the kind of person who, if you just have a tiny bit of dark chocolate or a little bit piece of fruit, then it satisfies your cravings. You just want to make sure that you're not getting into a situation where you're eating a whole bunch of sugar at one time, because that will really cause you to go onto a blood sugar roller coaster, and that makes PMS symptoms way worse because blood sugar inflames us, and when we're inflamed, it really affects the neurotransmitters in our brain, and that is how it affects our mood. So that is a huge thing when we're eating in the luteal phase. We really need to focus on protein, and yes, we can definitely increase our carbohydrates. We just want to make sure that they're high quality grains. So we want to be doing a lot of seed bread, protein pastas, brown rice, wild rice, and then whenever we're having a carbohydrate, just pair that with a protein. And then foods that we really want to lean into when we think of our anti-inflammatory diet, we want to do a lot of omega-3s. And all the omega-3 foods are almost all fish. So luteal phase is a time where you want to really focus in on your fish intake and chia seeds, which also have a lot of omega-3s. And then leafy greens are huge when it comes to antioxidant and inflammation. So that's when we want to be leaning into our kale, our arugula, our spinach, and then turmeric is huge. Cook with turmeric, throw it onto lattes. Spiced turmeric is very anti-inflammatory. So those are the foods that we want to focus on in the luteal phase to prevent us from having such severe PMS symptoms. And then oftentimes in our luteal phase, we get a lot of hormonal imbalances, either because our body's missing nutrients that it needs to make hormones properly, or we're not eating for our hormones, or we had a poor quality ovulation. So hormone balances often contribute to issues in our luteal phase. So it's extremely important that you get your hormones checked after ovulation. Usually I recommend doing it 7 days after ovulation if you have around a 14-day luteal phase. But if your luteal phase is shorter, if it's closer to 9, 10, 11 days, you want to hit the average of those days. So if you have a 10-day luteal phase, you want to get your blood drawn 5 days after you ovulate or 5 days before your period. And you definitely want to check your estrogen and your progesterone, LH and FSH, because we want to know, what are your brain hormones doing? Are they balanced in that phase? And then what are your ratios of estrogen to progesterone? Because if you have low progesterone, low estrogen, high estrogen, all of those hormone profiles can contribute to really severe symptoms. And then if you're a person that gets symptoms right before you get your period, for example, if you're a person that day you just want to crawl into a ball and you're super irritated at everybody, or you're like, that's the day I want to kill my husband, you really want to get your blood drawn on that day if you can, because in some people, their hormones are sailing away and they look good, and then they just crash and fall off a cliff on that day. And we say, oh yeah, that's the day I'm feeling horrible because my hormones are plummeting in the days before I get my period. But there are some people who actually maintain pretty high hormone values into their period, but the imbalance in those hormones can cause a lot of symptom issues. That's where we get a lot of our breast tenderness symptoms from, and that's where we get a lot of our headache symptoms from. So if you can check your hormones on the day where you're feeling the worst and right in the middle of your luteal phase, it can help grasp what your hormones are doing to give you a little bit of a map. So when we think about, oftentimes migraines, for example, can come from big changes in your estrogen levels. So if you're getting migraines, we want to think about, okay, do you have estrogen dominance? And if you do have estrogen dominance, we want to think about the foods that help us metabolize off of that estrogen. So sugar is a big one. We really don't want to be doing things like honey, cane sugar, maple syrup. Any form of sugar will fuel our estrogen production. So we want to break that down. Alcohol is another big one. You really don't want to be drinking alcohol, especially in your luteal phase. And then seed oils. So when we think about all of our omega-6s or our seed oils, those can also be estrogen promoting oils. And then we really want to avoid that. So processed and packaged foods is something you really want to stay away from in your luteal phase, especially those days right before your period. And then if we have low progesterone, for example, we need to think about, okay, what are some of the things that we can be doing to promote our progesterone levels? So we talked about omega-3s. If we're not eating fish 2 or 3 times a week, we want to be doing about 1,000 milligrams of omega-3, for example. And then anybody that has low progesterone, we also want to focus on the quality of your ovulation. Because if you're not ovulating well, your body's not going to be making a healthy corpus luteum. If it's not making a healthy corpus luteum, that corpus luteum doesn't have enough backbone or building blocks in order to make progesterone properly, and that can lead to a lot of PMS symptoms. So we need to look at the hormone profile and the rest of the cycle to see, why are we feeling so bad, or why do we have low progesterone in our luteal phase. So it's important to get your hormones checked and then make sure that you're looking at the entire phase and see what we need to be fixing to set up your entire cycle for success. So in addition to kind of eating for your luteal phase and getting your hormones checked, making sure hormones are balanced, other things that we think about are, how do we promote with supplements, for example, you feeling the best that you can. So if you have a low hormone profile, if you have low progesterone or low estrogen, oftentimes we use something called Vitex or chasteberry. That can be very helpful. And you can take that just in your luteal phase, but actually Vitex and chasteberry, because it promotes your estrogen production as well, you can actually take it every single day. It doesn't have to be just in the luteal phase. So that's something that can be really helpful. Also, magnesium is really helpful. And then we talked about, of course, doing about 1,000 milligrams of omega-3 every single day. And if your PMS symptoms tend to have a lot of mood component, my favorite supplements are L-theanine and GABA, because oftentimes our neurotransmitters can be a little bit dysregulated, and GABA and L-theanine can really help with those type of mood symptoms. And GABA comes in a powder, which is really helpful. So both of those things you want to take at night before you go to bed, that can help with mood symptoms. And then when we think about other avenues of helping our mood, we think about something called adaptogens. So that's going to be our ashwagandha, our rhodiola. If your mood symptoms are mediated by really high stress levels, I would definitely get your cortisol tested. And that's a test that I recommend doing through saliva, where sometimes we'll do a morning fasting blood cortisol level. But you really want to get a sense of where your cortisol levels are, because if your cortisol is sky high through the roof, it will really make mood symptoms way worse and make those PMS symptoms much worse. So if we tend to have really high cortisol levels, our ashwagandha and our rhodiola can also be really helpful in managing that. And then, of course, we want to think about our general stress reduction techniques to bring our cortisol down. And then if we're having high estrogen, or we have a lot of estrogen dominance, it's really helpful to do something called DIM, or calcium D-glucarate, so that we can help metabolize our estrogen and help with some of that estrogen clearance. But again, you always want to take supplements based on your specific hormone profile. You don't just want to take them randomly. For example, you want to take DIM if your estrogen is really high, but you don't want to take DIM if your estrogen is low. So make sure that you measure your hormones and tailor your specific supplements to your hormone profile. And then when we think about medications, we always want to start with nutrition. That's the core of everything we do. Eat to your luteal phase, and then supplements as needed. And the last part of that is bioidentical hormone therapy or other therapy for mood and things like that. So for example, if you have really severe low progesterone, oftentimes we'll use bioidentical progesterone in your luteal phase. Orally is the best form. Sometimes people will do topical progesterone or yam cream. It's just not going to cut it. If you just do a topical cream, it's not going to have enough absorption to help with your symptoms. So we really want to measure what your progesterone is and give you the right dose. And with progesterone, if we're going to supplement with bioidentical hormones, you never want to use that as a Band-Aid. We only want to use that to boost your mood, get you feeling better while working on the underlying causes. But bioidentical hormones can be really, really helpful. Another thing that can be helpful is for patients who have imbalances in their estrogen to progesterone, we can do bioidentical estradiol in that phase to balance our hormones. Or if your estrogen is going really high and then falling off a cliff, it can be really, really helpful to take oral bioidentical estradiol, especially in those days before we get our period. If we're having severe breast tenderness, for example, if we're having migraines, or if we're having really severe mood symptoms right before our period. I call it bridge dosing, because instead of your hormones just falling off a cliff, it helps us bridge and make that decline in our hormones a bit more gentle so that we feel amazing every single day and we don't feel horrible in those days before we get our period. So lots of different therapeutic options. If our mood is so severe that it's really affecting our daily life, it is helpful sometimes to start an SSRI or an SNRI. And the great thing is oftentimes we can even use those as needed. We use a lot of Zoloft or sertraline, for example, and that's a medication that can just be taken as needed. You do not have to take it every day. So sometimes people just feel like they need a little bit of a mood boost on certain days. You can just take mood medications on that day. Or if there are certain days in your luteal phase where you just need a lot more mood support, you can just take mood medication on those days. So you don't feel like you have to take a medication forever, all day long, or you're going to be on a mood medication forever. So lots of different medication options so that you can be feeling great. And then things that we also want to think about are those luteal phase times are times where we really do want to be moving our body. So just make sure, because your body is making a lot of hormones, those are going to be times where you can tolerate doing a little bit more high intensity exercise, for example. but you also have to be nourishing yourself because you need to be eating enough calories to be able to make hormones in proper amounts and keep that hormone balance that we need in order to prevent us from having mood symptoms in our luteal phase. So yes, we're going to need a little bit more carbohydrates. We probably need a little bit more calories in general, a little bit more protein, and then exercise to help us metabolize off those hormones properly. And in that same vein, we want to make sure that everything else is working as far as our detox pathways. So we do need to be having bowel movements regularly every single day so that if our body's trying to make hormones, we can metabolize those off properly and that our body's not having a bunch of side effects of having all that estrogen, but then not being able to detox it. So couple patients that come to mind when I think about this. I had a patient who came to me and she said, there are certain days in my cycle where I just feel rage. And she described it as just like really, really not feeling herself. And we mapped out her hormones and then we found out that she wasn't ovulating at all. So that means that her body wasn't making any progesterone. So if you're just making estrogen, you're just in this constant state of limbo where your body's waiting for your body to make estrogen, your body's just waiting for it to make progesterone, but then it never makes any progesterone. And then finally you just have a bleed because you can be having periods without having ovulatory events or without ovulating. And we discovered that she had pre-diabetes. So she has really high blood sugar. So I had her start a continuous glucose monitor and we just identified a couple foods that were really fueling that estrogen dominance. And then I had her take cyclic progesterone for a couple cycles to retrain her body how to make hormones in proper amounts. Because sometimes we can give cyclic progesterone to see if we can get you ovulating. And then if that doesn't quite get you ovulating, we can always give ovulation medication. But all she needed was 3 months of cyclic progesterone, and then we needed to get control of her blood sugar and have her eat a little bit more protein. And after those 3 months, we came off the progesterone and she was ovulating perfectly fine on her own. And we did blood work and I had her do a hormone map and we could tell that she was ovulating. She now had 14-day luteal phases. And we were eventually able to wean her off the progesterone. And she said, oh my gosh, I finally feel like myself again. I had no idea how bad I was feeling until my husband told me that I was so grumpy and that I needed to get help. And now that she was ovulating and we got her luteal phase hormones balanced with her blood sugar and getting her progesterone stabilized, she feels amazing. And she was saying, oh my gosh, I wish I would have done this a really long time ago because I had no idea that I wasn't really ovulating and my hormones were that off. I was just living life and I didn't exactly know what was normal and what was not normal. So PMS can be really hard to identify because sometimes it's just us and we don't exactly know like what is normal, what's not normal, are we okay? Sometimes it helps to just ask our husbands, ask our partners, ask our friends, do a little mood check-in, make sure that we're doing okay. And if you have any doubts, any hesitations, you don't feel good in your luteal phase, you get migraines, you get irritable, you feel like you have PMS symptoms, please don't hesitate to reach out. Come see us, come make an appointment. We'll check into lots of things, your hormone health, your gut health, your mood, look at all the different avenues that we could be working on to get you feeling your best self every single day. So thank you so much for joining us on this episode of the Hormone Café, and tune in for our next episode where we'll be talking about gut health.